And then next, I just wanted to share with the families. This is what we have done to really understand, because again, a lot of limited information on this disease. And we really wanted to understand, what is the late onset GM2 patient journey? What does it look like? We wanted to understand the physical, emotional aspects of the patient journey, including symptom onset, the diagnosis, and the ongoing disease management. So there have been some surveys and interviews with the late onset Tay-Sachs and Sandhoff community. Again, patients and maybe some of the patients that are here have participated, and I thank you in advance for your frankness and the feedback that was provided, and as well as some of the caregivers in the US have provided feedback for this interviews and surveys that were done. All patients were over adults, and there were also interviews that were conducted with GM2 expert physicians in the US and abroad, in UK, Germany, and Spain. Research is still ongoing, but this overall poster summarizes the interim findings. So I just wanted to take a couple minutes to walk you through the patient journey and what we heard back from you as the patients. And what we've seen is that about 40% first experience symptoms in childhood, with a median age about 10. So pediatricians tell patients and caregivers that the patient is, that they're normal, and patients believe them and cope with everything that they have to do by avoiding the activities and trying to work harder. And some of the emotions that they're facing is they're self-blaming themselves. In their own words, they're saying that I was feeling clumsy and walked funny, but thought that I was normal. And so that's kind of the first thing that they have in their mind when these symptoms occur in childhood. The majority of the symptoms occur in their 20s, and the adult symptoms occur in the 20s, with the median age at 24. And patients, again, continue to believe that they are normal as symptoms worsen, and they cope by avoiding lengthy walks, either to school or work, and they just try to get stronger. So they're confused. Again, some of the quotes from some of the patients that we surveyed, and the feedback was, well, my friend said my walk wasn't normal, but I thought I needed to get stronger. So they're still trying to persevere and push through everything to cope with everything that they are given. So the persistent worsening of the symptoms are still occurring. And finally, the friends and family tell them that their issues are not normal and they should see a doctor. So this is the trigger for the healthcare visit in adulthood. So the median number of healthcare professionals that these patients visit is about 4. And there's a very varied range. So anywhere between 1 physician to 12 physicians that the patients and caregivers need to attend in order to see what the diagnosis may be. And so this is the start of the cycle of no diagnosis and misdiagnosis. Patients usually see neurologists, geneticists, and internists, and about 60% receive misdiagnosis of either amyotrophic lateral sclerosis or spinal muscular atrophy are as the most common. And it takes, the median time to diagnosis is about 13.5 years from symptom onset. And again, the range is very variable, anywhere between 3 years to 33 years. So by the time the GM2 diagnosis is made, usually it's by a neurologist. About 2/3 are done by a neurologist, and less than a quarter by geneticists. And again, the patients feel by this time finally relief that the GM2 diagnosis was, that the patients did receive a diagnosis, but it's also scary. So patients living with GM2, their patients have fear that they have a loss of ability to walk or speak, and patients are forced to stop work, or sometimes they have to move back with their parents. So they feel a sense of anxiety, where they say that the late onset GM2 takes everything from you, and it's a terrible disease. So again, I really thank all the participants that have participated in these surveys and interviews. And I'm just sharing with you the feedback from the story on the GM2 patient journey, which is very impactful. On the bottom of the slide here and on the poster, you will see the symptom area where patients have identified symptoms and in the legs and walking with balance, fatigue. And you could see the earlier symptoms and the percent of patients that have experienced it, and then how it progresses in the adults in the later symptoms, and how many patients experience it at a later time frame. So just to conclude, in regards to this overall poster, is that what we have seen and what we have heard is that symptoms typically emerge in childhood or young adulthood, and diagnosis often take over a decade. And it's common misdiagnosed, including ALS and spinal muscular atrophy, and treatment is limited to symptomatic management. Patients are often very frustrated with the healthcare providers, and patients lose the ability to perform activities of daily living and fear the complete loss of an independent life. So again, I think for us, it was very, very much compassionate awakening of what the patients are going through, and need to better understand what we could do to support the patients as well as the community and caregivers. And with that, I think I am out of time, and I will pause and take any questions.